Hi everyone, this is Dr. Stefan. Welcome to Interstitial Lung Disease Info. In this episode, I'd like to talk about how to improve pulmonary fibrosis care. So within the scope of interstitial lung diseases, we talk about pulmonary fibrosis, we talk about scarring of the lungs, which in some cases can be progressive. And it's one of these areas of medicine where awareness is limited. Even among medical circles, among nurses, doctors, acute medicine physicians and emergency room physicians, primary care physicians, there's less awareness than you would expect. And I've recently attended this meeting where people who are working in this field, especially people who work for charities, who represent patients, they were talking about this journey that a patient with pulmonary fibrosis needs to go through. Every time they need to go to hospital, for example, they need to explain what pulmonary fibrosis is in their case to every level of care. So they may meet their family physician, their general practitioner, and they need to explain that they have pulmonary fibrosis. This is what the medication they are taking is. This is what the side effects are. Then they go to the emergency room. They need to be treated potentially in a different way because they have pulmonary fibrosis and they need to explain all of these things. Then they go on to a general medical ward for some reason and they need to explain this to other physicians in the hospital. And it can be so frustrating. And you can imagine if you're a patient and sometimes you're a professional patient because you know your condition so well, it can be very, very tiring to keep explaining the same thing over and over again just to get the appropriate care. So I really want to make a call to raise awareness in primary care, first of all, and then among other specialists in medicine, among the general population, the people who maybe don't have pulmonary fibrosis, never heard of it. Maybe let's talk about it a bit more. Because if we start doing that, if we talk to maybe politicians who represent us in the community, to commissioners who fund health systems, who direct the money where it needs to go, we can raise awareness of this terrible condition. And someone who is suffering with pulmonary fibrosis or a carer of a person who suffers with pulmonary fibrosis will know that it's such a terrible condition. And we need to have more resources to treat it, because it's not only medication, it's the entire infrastructure around running an interstitial lung disease service. That requires specialist nursing, that requires time, consultations that are dedicated to patients with pulmonary fibrosis. A lot of things need to be adjusted. And there's a huge issue with capacity, especially as we are finding more and more cases. And what do we do with those? Some people nowadays have CT scans of their chest for various reasons. And pulmonary fibrosis is sometimes picked up very early. But nothing is done because there is no appropriate pathway, because there hasn't been enough awareness to actually stand up and say, there is this huge group of patients who have maybe early findings of pulmonary fibrosis where we do not know what the right pathway is through the health system. So we need to raise awareness about that, because there is effective treatment. We have treatment for pulmonary fibrosis and many people are not aware of that. There are treatments that reduce the rate of decline. So even if the condition is progressive, it may get worse over time. There are medications that can reduce this rate, buy us time. There is also supportive care where there's a lot of need. So just thinking about lifestyle changes, going to pulmonary rehabilitation, getting an oxygen assessment, all of these things are important. So if we're treating other conditions that the person may be suffering with, imagine someone who suffers with idiopathic pulmonary fibrosis may be quite elderly. They may be in their 70s. They may have high blood pressure, diabetes. We need to treat these well. What are the right medications? Do we do enough research to know what the right medication is for this specific group of patients who suffers with pulmonary fibrosis? Among all the blood pressure medications, which one do we pick? We don't have that information. We don't have that research. And I recently attended this meeting where one of the professors who was talking was saying that among pulmonary fibrosis patients, only 1% take part in clinical research, in clinical trials, 1%. So you can imagine that we are not exploring this condition well. There's not enough research being done. There's not enough staff to deal with the numbers of patients that suffer with this condition. So we need to really work harder to try to raise awareness of this condition. And I would suggest that we first start in primary care. So if you talk to your family physician, your general practitioner, tell them about pulmonary fibrosis. Maybe in a gentle way, just direct them to the appropriate charities in the space. Not telling them what to do, but just making your needs known as a patient with pulmonary fibrosis. And do not blame the doctors. It's very hard. It's a rare condition. It used to be thought as a rare condition. When I was in medical school, there was hardly anything that was taught about pulmonary fibrosis and how it actually behaves in real life. I've learned this later in my career because I chose to go into this field. But other people may choose to go into other areas of medicine, and they are not faced with patients who suffer with this condition. So raising awareness is really important. Talking to politicians, funding services that will take care of patients with pulmonary fibrosis. And not only medication, not only doctors, we need specialist nurses who know how to treat patients with pulmonary fibrosis. We need to be treating symptoms. So people who suffer with debilitating breathlessness and cough, we need to treat these. We need to try to identify the causes. There are things that we can do. And I want to keep talking about this on this channel, on this podcast. I want to keep delving deeper and deeper into the field of pulmonary fibrosis because I'm passionate about it. I like it. It's something where there's a huge unmet need. So I will be making more videos, but this is just my way to try to reach more people. But everyone needs to become their own advocate, because that's the only way. Unless a lot of us are talking about pulmonary fibrosis more, it will never get the attention that it deserves as a condition that is increasing in prevalence. So there are more and more people being diagnosed with this condition. There are a lot of people who are diagnosed early and we don't know how to best treat these patients. We need to do more research. We need to talk about things like palliative care services and early referral to these things that sometimes they sound as if it's end of life, it's terminal. But sometimes palliative care can actually be a solution to dealing with day-to-day problems for patients who suffer with this condition. And we need to work on the stigma associated with palliating conditions or improving conditions, improving how we manage, how we deal when we have a chronic severe condition. So this is just an introductory video, but I think I'm going to make more on this channel on this topic because I think we need to work harder to raise awareness, and I'm going to try and do my part through these videos. If you find them useful, share them with anyone you think might be interested. And yeah, let's keep going. Let's try to beat this condition, or at least to find ways to provide the care that exists so that it's no longer such a lottery, depending on where you live, to get the appropriate care. Thank you very much for watching, and I'll see you in future videos. All the best. Good health.